Hello, everyone. This is Subrat here again for our weekly talk. And I know I got a lot of questions, uh, but this is something I feel it is important because this question has been asked to me again and again and again. Because I can take only one question per week to explain. So this is what I'm going to tackle today. Um, so, uh, in our life, of course, the breathing is important. We have to breathe unless you are expert in holding your breath. I can, over the years, by practicing, I can barely hold my breath up to a minute, which is I think is kind of good, but that's how far I can go. So breathing is extremely important for our life. Second thing, of course, it is water because, you know, 24 hours, maybe if you are good enough, if you are trained enough, maybe a couple of days, but it'll be hard to survive without water. And the third most thing is sleep. So if you don't sleep, you feel like as if you are going out of your mind. Well, that is a torture too. So you do everything you want to do, then you do not allow a person to sleep. And you know how it feels. So first thing you need to understand why sleep is so important. Because sleeping is the time when you sleep, uh, as if you know how you repair a boat or a big ship, you dry dock it so that all the repair can happen of the water. So sleeping does something like that. All the repair, because our body is continuously working. We are aware or we are unaware, does not really matter. Our body does its own job all the time, 24 hours a day, 7 days a week, and it start working since we are born, and it's going to keep working till we are die. So sleeping gives an opportunity for your body to take care of this thing, what needs to be taken care of. So in absence of a quality sleep, I'll get to sleep and quality of sleep and all this kind of stuff. In absence of this sleep, that's why neither your body have the ability to function correctly or your mind. And among all these things I'm going to talk today, I am not going to consider age because the sleep problem can happen younger children too. You probably are hearing all these things, and that's the reason why all these things are happening in younger children. So I'm not talking about old or young. We need sleep. So when you are younger, like imagine a baby, they need more sleep because they are in a growth phase. So they are growing. So there's a lot more thing going on in their body for to make them grow. So that's why they are sleeping more. As we get more matured and older, we need sleep to maintain. So that is the time anything which is out of whack or anything, any inflammation is going on, to take care of that. Any repair needs to happen to take care of that. Any healing needs to happen to take care of that. All these things happens during our sleep, including our brain function, our digestion, everything do happen during the sleep. Now, um, if you have noticed, if you are not sleeping well, then you don't feel good. So you might not sleep a couple of nights back, but it's backtrack. Things happen a little bit later. Okay. And that is kind of a problem. And sleep actually represents the overall health of our body. Okay. Our body is amazing. It can take a lot of abuse, it can take a lot of stuff. But as we can get by eating bad food or wrong food for a little bit, the same way we can probably can our body can handle not sleeping for few time, maybe few days, but then it can readjust. But if things continue again and again and again and again, it creates a huge problem. Your body is confused. Your mind is confused. And if you have ever traveled overseas, uh, and if you ever had a jet lag, which I many times do when I travel overseas, you can see that how it do affect. Then you don't feel hungry anymore after you are flying, and your day turns into night, and your night turns into day. You don't feel hungry, and you don't feel good. Then it takes time a little bit to adjust to it. So my whole point of saying all these things, sleep is extremely important. So we cannot bypass it. We just cannot say, well, whatever I can do, whatever I want to do. So there are few myths are there about sleep. So this is what I want to talk about. So the number one there, you will hear, oh, you need to sleep for 8 hours. Okay. And you have to sleep 8 hours at a stretch. It does not really matter. Your body is your body. We don't have a time limit. So the amount of sleep I will need, the amount of sleep may be needed by somebody else, my wife. And it could be amount of sleep would be different with my daughter, my son. So depending on who you are, the time may vary. Because I have seen over the year, people can sleep. I personally sleep around 6.5 hours, something like that. And I do fine. Okay. And I know many people, many of our patients, they do sleep. They go to bed, they fall asleep, and they were awake after 4 hours, completely awake. They're so awake, they go do their laundry. Sometimes they took their dog for a walk, something like that, and they'll come back and sleep again 4 hours, and they just do fine. So it is not really true that you have to sleep at stretch. So if you are sleeping in batches, you are doing okay. Or if you are not sleeping for 8 hours, if you are sleeping 7 hours. But what really matters though, what we need to focus, we focus how do we feel the next day, the day after that, the day after that. So if we can function normally, not feeling sleepy, not feeling drowsy and all these things, so we are sleeping fine. So we don't need to stress out, oh, I didn't sleep for 8 hours. So this is something we do create in our own mind. And that creates stress. And stress is the problem which kind of contradict with your sleep. So 8 hours is not necessary. You can sleep in pocket. So it all depends how you feel, down the road, the next day, the next day, the next day, how you feel. And second thing is that how you know that you are sleeping well, do you dream? So if you dream, I am not saying you good or bad dream. So as long as you dream, so that is your interpretation. Dream is a dream. So there's nothing called good or bad. So how you're going to feel it? Yeah, as long as you dream, you are doing fine. It means you have the depth of sleep. So when we sleep, we do not sleep like that. Our sleep, you started falling asleep, then the sleep get deeper and deeper and deeper and deeper. Then we come back up, kind of an awakened state. Then we go back. The whole thing called as a sleep cycle. And that goes on and on and on all night long. As long you are sleeping, it's going to go up and down. And between, if the depth of sleep is good, that deeper sleep, which is very important, because that is where most of the healing and the repair do happen. So if the depth of sleep is not there, then you know that you are not dreaming. And this is where it really happens when you are taking any kind of medication. Medication actually interferes with the sleep. It does not matter. One time, I'm going to tell you my experience. I always sleep good. Last year, I had kind of brushed with the poison ivy or poison oak or something like that. I was not really sure that what it was and how bad it can get. And actually, I had like blisters all over my body because of that. So I didn't have a choice. I usually do not take any medicine, but I didn't have a choice. So I have to take 6 days of steroid. And once I started taking, boy, I just couldn't sleep. And I have no problem sleeping. I'm telling you from my personal experience how that can affect. So for sleeping, if you're taking sleeping pill, that is actually, it is not going to work, because sleeping pill can make you give you a false thing that you are sleeping, but not the depth of sleep is not happening. So the purpose of sleep is we are not able to get if you are taking any kind of pills, especially narcotic pain medication, muscle relaxers, those things that I can go on and on and on the list. But the medicine itself can interfere. I'm telling you, the steroid that actually interfere with my sleep. So any kind of medication you take that interferes with sleep. So it is a catch-22. It is a vicious cycle. So you are taking all this medication to feel better because of the pain, or maybe you cannot sleep and all these things. And then the healing happens when you are sleeping. So it's messing up the healing system. So no matter how much anti-inflammatory, how many medication you take, if you are not sleeping, the inflammation is not going to go down, period. So anybody who we treat here in our clinic, and many of you who are watching our past patients, within first or second visit, what really happened? Your sleep quality changes. That is the first thing needs to happen before any of this pain or any of this thing goes away. If you're not sleeping, taking care of the pain, taking care of the inflammation, whatever the diagnosis, the name, that is just a wishful thinking. That does not work that way. We have to normalize sleep. Now, why we cannot sleep? First, it begins with habit. Sometimes we develop habits for a long, long time. It is interesting, I'm going to tell you one of my patient's story. What happened when she come here, actually she has a lot of pain, and over the period of time while we are treating, she tells me that, well, because of my pain, I couldn't sleep. I said, well, when you first having pain, so before that you are sleeping well? He said, no, I have a habit. I cannot sleep too early. So I used to sleep, go to bed at 1 o'clock in the night, and that's how I toss and turn, and I sleep at 3 o'clock in the night. Then, when the pain comes back, then I didn't want to even go to bed. I was sleeping in a recliner. So it is a vicious cycle. So I'm not going to discuss here today sleep creates pain, means sleeping problem creates pain, or pain creates sleeping problem. But the whole thing, we are trying to bring the body back to normal. So if you want to be back to normal, sleep plays a big role. So we created a habit, how we sleep. And the second thing you need to ask, do you have a bedtime ritual if you're having a hard time to sleep? So a ritual usually helps. And last but not the least, and actually this is an extremely important point, like if you are on screen, that actually creates problem, because this is how a sleep works normally. So once the sun goes down, your body produces another kind of hormone called melatonin. It produces, because your body cannot perceive the sunlight anymore. The light went down. So as the level keep rising after sundown, which is kind of get to an optimum level almost like 2 to 3 hours after sundown, then you feel sleepy. Then you sleep. So many things get messed up in between. So if you are constantly on phone, so that blue light mimics as if it fools your mind, your brain, that the sun is not down. So the level is not going to rise. So no matter how much melatonin you take, because this is what we do, we stop doing the simple thing, which is all natural. This is how it's supposed to be. Now we add on stuff to help, but we cannot bypass the nature. That does not work that way. We cannot bypass the nature. So nature already know what to do. So if we do not have a sleep rhythm, we sleep whatever, whenever we do. So many times, I get onto my daughter because she's only 17. She'll talk to her friends sometime beyond 11 o'clock. I say, well, this is not a good time to talk. You do your talking during daytime. In the nighttime, you got to relax, read a book, something like that. So when we are watching TV, which many people, they have TV in their bedroom and they watch TV in bed. So all these things kind of create problem, and this does not allow the level to go up. So we don't feel sleepy. So broken. Now we don't sleep. Now it can trigger a lot of inflammation and pain. So what I'm saying basically, to normalize the sleep cycle. Okay. So when we treat patient here, so we give them all this thing, how they can sleep normalized. Yeah. So today I'm going to tell you what you can do to do sleeping. You need to have a hard look all the medication you are taking that is interfering with sleep. Actually, if you are taking any kind of prescription medication, probably it is interfering with your sleep. Second thing is that if you can limit your screen time after sundown, it is a good idea to limit your screen time. Another thing, at least we are supposed to feel sleepy once we get a little bit hungry. So we need to have minimum 3-hour difference between when we eat and when we go to bed. So sleeping usually does not stay, it is seasonal. Okay. So in summertime, your sun stays longer. So your bedtime needs to change accordingly. So what is good, 2 to 3 hours after sundown is a good time to sleep. Okay. Last but not the least, because this is a problem happen. So if you are one of them watching, you have a sleeping problem, that 2 problems happen. Number 1, falling asleep. You just don't fall asleep. Okay. Number 2, staying asleep. Yes, you fall asleep, but you wake up multiple times during the day. So these are 2 different problems. Actually, it's the same problem, but it shows up differently. So falling asleep. So the reason you cannot fall asleep, remember I was talking to you, that lady who couldn't sleep? Then what she did, I said, what do you do if you cannot fall asleep? Then she talks to anyone she can find, anybody who can. So when you keep talking or you watch any TV news or anything like that, it produces a lot of stress unknowingly. So we need to cut down. So when we go to bed, we can stop. We need to stop thinking so much. We cannot be stressed and hope to fall asleep. That does not work. Your mind is the first thing, has to be calm before we go to bed. Okay, another way of calming your mind down. I probably not be able to cover that here on video, but you can follow me, whatever platform you are watching me, just follow me. Or if you ask any more question or following question, I'm going to cover that. Hopefully next week I'm going to cover that, how you can calm your mind down before you go to bed. But in order to do that, you have to be live with me so that I can take you through the whole process. Yes, you can do other things. So first thing, you have to stop anything that you need to identify yourself. Nobody else can do that for you. What produces stress? It could be a family member. It could be your own daughter. It could be a husband. That's okay, because you need your sleep. If you are not good yourself, what are you going to help anybody else? So the sleep is extremely important. So do not do anything that can produce stress. Do not watch news. Okay. Or you be on your phone or anything of that nature. And if you can avoid that, that'll be great. And if it is getting summer now, if you want to take a bath before bedtime, that is extremely calming. Take bath. If you want to sit outside where the weather is nice, you can do that. That is also calming. That is going to help you to fall asleep. You want to read a book in bed, that is wonderful. Reading book is pretty relaxing, because you are not creating any kind of electromagnetic energy, or you are not looking at a screen. That is wonderful. So you need to have a bedtime ritual, no matter if you cannot sleep or you can sleep a little bit. So unless we follow the ritual, your body does not know what to expect. Body does whatever it is expected. So if we create a ritual, so your body is going to fall into the pattern. So once it falls into the pattern, your sleep quality is going to improve. Now, how do you know your sleep quality is going to improve? Then you start dreaming. You remember the dream, does not matter, is a good dream or a bad dream, but you start dreaming. So once you started dreaming, then you know that your dream is getting better. Not only that, you feel more fresh next day. And once you are sleeping right, all the diagnoses, whatever you heard, back pain, shoulder pain, chronic fatigue, this, that, everything is going to fall back to sleep, to place. So the first stage is to normalize your sleep, and that is a good thing to do. So have a ritual. So whatever ritual works for you, you don't have to change everything one time, but you try. And I know that is one thing I just suddenly come to my mind. Many people are afraid. They think that, well, if I drink plenty of water, then I'll go up to pee, then I cannot fall asleep after that. So there are way of doing it. So just stop drinking water 1 hour before you go to bed. So, you go to the bathroom, then you fall asleep. So many ways are there. You can adjust, but the key is you need a good night's sleep. Even if you are sleeping in installment, 6 hours, or maybe 6 hours and 2 hours, whatever is the installment, there's no need to stress about. As long as you are sleeping, you are good. So go ahead and comment anything you like to comment, you want to hear, and any of your strategy, this work, any of my past patients here who have been treated. So comment how you're sleeping now, if you're having any problem. So I'll be happy to answer all those questions. And thank you so much for being with me today. And I'm going to see you again next week. Thank you again.